Good morning.
Hello, how are you?
Good, how are you?
Good, my name's Stacy. I'm a nurse practitioner, and thank you for letting me come to your office.
Sure, as you know, I'm State Senator Nozzolio, and I'm happy to meet with you this morning.
Thank you.
Let's go ahead and take a seat.
Why don't you tell me a little bit more about why you're here today?
Yes, thank you, I'd love to. Approximately 2 million incarcerated individuals are in the federal, local, and county jails, as you may already know. Of those, approximately 95% of them are released back into the communities that they come from with little or no access to health care. Now, this is a very large problem, as the inmates are also at higher risk for hepatitis, HIV, hypertension, diabetes, and they're released without any reference to healthcare follow-up, and so they end up in emergency rooms and not really having access to healthcare due to many barriers, such as access to healthcare itself. With the new act, the Accountable Care Act, it would be much easier for these people to have access to care.
So let me ask you a couple of questions. I heard you say that inmates are at higher risk for things like hepatitis. Why is that?
They many times don't even know that they have it once they are incarcerated. A lot of times they have come from the streets, they're drug abusers,
Sure.
IV drug abusers, things like that. So they end up into the jail system, and it's at that point in time that they're even diagnosed with hepatitis through the testing that's done in the jail itself. So it's very important that they have follow through when they get out of jail so that they're able to continue with their treatments for many of these chronic health problems that they have.
So it seems like inmates, they get poor to little access to health care when they're on the outside. They get incarcerated for whatever reason, they receive health care services, and then what happens now when they're up for release?
So right now, there's not very many mandated programs that do happen within the system. A lot of local county areas, such as our own county jail in Monroe County, do have a small reentry program, but unfortunately that part of it does not include healthcare itself.
So tell me, what does this reentry program include then?
The reentry program right now is a pilot study that's happening at the county jail. Within one of the units itself, it's the drug and alcohol rehab unit. And what they're trying to do is really do comprehensive rehab. So they assist people with drug and alcohol programs. They have educational programs. Some of the inmates actually graduate with their GED if they are in the jail system long enough. They do have certifications in job, like OSHA, and also air conditioning, heating type of certificates, food management. And if they do have a mental health problem, they are able to get them connection on the outside, but a lot of that is not forwarded through the healthcare part of itself, with the diabetes, high blood pressure, heart problems, things like that. So I think it's very important to have those type of programs also part of their reentry program, as there was a study done at Washington State Prison that concluded that inmates that are released are at 12 times greater risk of dying after they're released the first 2 weeks of their release.
Wow.
So it's was a very good study that did show this in retrospect. A lot of that was from drug, alcohol, suicide, homicide, but there was also cardiovascular problems. People had heart attacks, heart problems that they didn't have attention for their health care. So right now there's a bill that has been in the Senate and the Assembly. We're hoping that the governor will sign this, so if you have any pull, that would be great to get in there. What I was wondering is, what kind of programs are you interested in? I was hoping that you'd be able to have some persuasion within the Senate itself.
So I'm glad that you asked that question. As you may know, I previously served as a member of the National Women's Hall of Fame Board of Directors. I'm also a member of the First Niagara Bank Citizens Advisory Board. I've been honored by the New York Association of Psychiatric Rehabilitation Services with their organization's Public Policy Leadership Award in recognition of my efforts on behalf of individuals with psychiatric disabilities and my sponsorship of legislation to make New York's prisons safer.
That's great.
The New York State Association for Behavior Analysis has also named myself their Legislator of the Year in recognition for my service and continuing support for individuals with autism and other developmental disabilities.
That's great.
So I have a vested passion for those who are incarcerated and being released back out to the public. And my personal stance is we need to help support these individuals so they become productive members of society versus becoming potential victims, again, of their own both current psychiatric as well as substance abuse challenges, in addition to obviously other modifiable health behavior risks. So I'd like to think that I'm on very good terms with the governor, so I'm hoping that this bill will in fact be passed, within the next few months. Nothing happens very quickly, as we all know, at the state level, but I am optimistic at least that we'll be able to make some progress.
That would be wonderful, because as the bill states, as you know, that it would give the information to the inmates when they are released. They will have an exit interview with the commissioner at the time. It won't change their release date or anything like that, but they will have an exit interview and they'll be able to have information that will help them. Someday what I would hope is that they would really institute a standard program where they actually take it one step further and initiate kind of a referral process, which was what I'm trying to do at my level and with my capstone project at the University of Rochester, is to be the facilitator to have appointments made for them. As you know, these people don't make good choices, so they are left on the street to decide, do they go back to where they came from, or do they go with their flu shot? They really need that helping hand to get them into the clinics.
I challenge that perception that they don't make good choices, because I feel as though we as a society have an obligation to be able to inform and to empower our own individuals and constituents so that they have the information that they need in order to make informed decisions.
Yes.
And it really sounds like that your capstone project is targeted and focused towards helping individuals who are at very high risk being able to successfully navigate that transition from incarceration out into society. I am so pleased to hear that you are involved with this, because I think that there needs to be more pilot studies and more programs just like this to help build our understanding for what we can do to help those who have been incarcerated be successful at release.
Thank you. Well, I appreciate your time and letting me come and chat with you, and I really hope that you can put in the good word to the governor that this is something very important to do. Thank you for your time.
Thank you very much.
Thank you. Hello, Senator. How are you today?
Good. How are you doing, Miss Stacy?
Very well, thank you. Thank you for having me back again.
Certainly. It's my pleasure.
I just wanted to chat with you a little bit more and make sure that you understand that this is really something that's very important.
Certainly.
Since our last meeting, I'm happy to say that the Assembly, which you may or may not know, did pass this bill into their congressional times, and I believe also has been passed with you and your senators. So now it has been brought to the table of the governor. So we're just waiting right now. As you had said earlier, sometimes these things take some time, but I am very happy that at least it's been passed within the two parts of our legislature. What I really wanted to go over with you and just remind you that is very important is that the social aspects and kind of the economical plunges that this really has on society. Socially, it's really important that these people do have follow-up. I think it's important in the fact that they do have some financial limitations with healthcare, and that the new Patient Care Act will be able to really help them with their health care and accessing health care. So that is wonderful that we'll be able to bring that to the table, and that the barriers hopefully will be breaking down and we'll be able to help the inmates with health care. Another big problem is that the economic force with this is that it is costly for health care. So once again,
Absolutely.
to be able to have this on the table will help them. And if people are healthy, then I think this will also help them go out, they find a job, they start working harder, and they bring themselves to the table as a part of society. So that helps in many ways for them to be able to be part of society and have a worthy
Of
system.
course, I think that one of the things that people need as just motivators of human behavior is a reason to get up every day. And so
Exactly.
if we help folks transition from incarcerated life where there is a schedule, a routine that they can anticipate day after day what's going to happen next. We can help them transition from there, from the structured environment, out to the real world, so to speak, where they're placed sometimes right back into the same situations that they had executed some poor choices in before, and instead be able to offer them different choices and be able to give them, not to sound trite, but a reason to live. I think
Exactly.
that this really stands a very powerful chance of being able to make an impact on the recidivism rate, so
Yes.
avoiding people from being reincarcerated. I can't tell you how passionate I am. I share your passion, Miss Stacy, about this
Thank
topic.
you.
So,
Thank you so much. I appreciate that.
oh,
And
certainly.
I think a part that we had talked about before with the education is, or maybe we didn't touch upon that, but education is very important.
Certainly.
Health literacy, I think to take this to the next step once we do have those programs in place, is really to help people understand the importance of health. Something very simple as hand washing, people don't understand that can really stop the spread of germs in their path.
So how would you propose that we get this kind of information? I couldn't agree with you more. Let me start by saying that. How do you propose that we get this kind of information to potentially inmates while they're still incarcerated, or perhaps after they've transitioned out into society?
I think part of what is very important is catching them when you have their full attention, and that would be when they're incarcerated. They do have many programs in the jail, information type sessions, they have interfaith type sessions, things like that. So I think you could bring healthcare to the inmates in many different venues because of the education levels. You cannot always have reading materials. So if you had videos, health education videos, kind of like a running type of wheel that would go in their unit on a video screen that could give them verbal information about healthcare. And also you could have pamphlets available and classes. You could have volunteers of health, maybe medical students, nurses, nurse practitioners like myself, go into the jail and engage them in conversation and just talk with them. And I think by doing that, it will really help them understand that health is important and that you're taking the time to talk with them about it. Sometimes they just need to know that somebody does care about them, and I think that's very important.
I could not agree more. To me, it sounded like you were using some of the principles of adult learning theory to be able to reach out to people at the point in their lives where they're at a teachable moment when you have a captive audience.
That's right.
No pun intended, but while they're incarcerated, there's really not a whole lot else that they can do. So it sounds like, you really have a very thorough, excellent comprehension of the healthcare system as it stands right now with inmates, both while they're in prison and upon their release. Did I hear you say something about that you're doing a capstone project?
Yes, at the University of Rochester, where I'm in the doctorate program, we do a capstone project, which could be any type of initiative. And so what I'm working on now is being the facilitator of healthcare through a program called the CATCH program, which is an acronym for Correctional to Community Healthcare. So
I like that.
Thank you. My idea is to, as it says, to catch everyone that would be falling through the cracks. So there's a little fun in it, but it also is something very important. So what I would like to do with my project is be able to coordinate the healthcare follow-up needs of the inmates at the county jail in that specific drug and alcohol rehab unit that we had chatted about before. And then they would have specific follow-up information. That clinic would have a referral fax to them from the caseworkers at the jail, and they know exactly when their follow-up appointment would be. So they would be released with a healthcare card, information of follow-up, the easiest means of transportation in that area clinic. The one I'm working closely with right now is the Anthony Jordan healthcare clinic, as that they have clinics in all 4 quadrants of the county. So it would be easier for them to get to if they have healthcare where they are released to when they go home or wherever they may go. So
Well, this sounds like an excellent project. When will you be done?
I'm hoping in May of 2015. So we'll be working hard.
Well, Ms. Stacy, I wish you the very best of luck.
Thank you so much, sir.
And I will certainly make sure that either myself or one of my aides keeps you updated on progress of
Thank you.
this bill. And once the governor signs it, I want to make sure that you stay just as motivated as you are now and you help continue our inmates with their transition back into society. Thank you very much.
Thank you so much. I
Nice
appreciate
to
your
meet with
time.
you.
Thank you.